Emmy, do you want to explain how tailbone pain happens? In today's video, I'm going to literally talk about the pain in your butt, also known as coccydynia or tailbone pain for short. Now, as a pelvic floor physical therapist, I'm supporting a lot of patients with tailbone pain in my office. So in today's video, I'm going to talk about why does this happen, what are the common causes, and what are the important solutions that you want to start implementing ASAP to be able to get rid of your tailbone pain for good. So what commonly causes tailbone pain? Yes, there can be an acute injury where the tailbone itself gets injured, like when we take a fall or often during a vaginal childbirth incident. However, when someone has chronic long-term tailbone pain, there is almost always a muscle component. There are a lot of muscles that attach to the tailbone. Very quickly, let me point out here, we have the tailbone from the inside of the pelvis, right where my finger is here, and the pelvic floor muscles are attaching directly to it. On the back side of the pelvis, we have the spine, the sacrum, and the tailbone again right here. And we have really big glute muscles and hip muscles that also are attaching to this area externally as well. And then lastly, we have spinal muscles that are attaching on the spine, that are running down, and that also affect the tailbone. So if we have any tightness and or weakness in these muscles, they're going to create a tug-of-war on the tailbone that will eventually lead to irritation and long-term pain if that tension is not addressed. Let's talk about why these muscles get tight and what can often contribute to this situation. So in the case of a fall or an injury during childbirth, those muscles will often tighten as a protective response to an injury. But long-term, if that's not addressed, then those muscles are going to stay in a tightened position, and that's not going to allow the body to move well, and that also includes extra pulling and strain on the tailbone itself. In a situation where this gradually develops over time, where we didn't have a specific injury or incident, we can have a gradual decrease in muscle strength around the pelvis. And if those muscles are losing strength, then they will start to get tight over time. Certain muscles will start to sub in for others, and all of a sudden we're going to have a situation where our hips, our core, and our pelvic floor are getting tighter and tighter and creating more and more pull and strain on that tailbone as a result. So what are some helpful ways that you can fix this and overcome your tailbone pain? So first, in the short term, I'm going to give you 3 tips that you can already start to implement today. So number 1, while you're in a standing position, it is really important that you check in and notice how often you are squeezing your butt underneath you, and often kind of in this more passive stance, putting a lot more stress and strain on the back portion of your pelvic floor and overusing your glute muscles. Many of my patients with tailbone pain are shocked to notice how much they are clenching their butt throughout their day, especially in standing positions. This is creating a lot of stress and strain around that tailbone, and so improving your standing posture to have your rib cage stacked right over your pelvis, right over the mid portion of your foot, is going to allow your body to stand in a more ideal posture and better distribute your body weight throughout your entire pelvis and take that load off of your pelvic floor. For all the parents out there that are suffering with tailbone pain, the posture that you are often holding and carrying your little ones in is also another big contributor to your tailbone pain. Your pelvis is often kind of pushed underneath you. You're clenching your butt to be able to hold that top heavy load as you lean your rib cage back, is actually asking your glutes and your pelvic floor to do a lot of clenching to hold you in that position, which is then creating more irritation to your pelvic floor if that's your position often throughout the day. So we want to really bring that top heavy load with your kiddo a little bit more forward so your rib cage is stacked over your pelvis and over both of your feet so you can better distribute that load and take the tension off your tailbone. Now, number 2, when you are sitting, you want to make sure that you are not sitting in more of that kind of slouched posture for very long. This is going to put a lot more stress and strain on the tailbone due to that position, which is again going to cause more irritation. So you want to invite yourself to sit more upright and stacked, similar to standing, where you want your rib cage right over your pelvis so you can feel yourself balanced over each sit bone underneath you. That's going to offload any tension and strain on the tailbone itself, which will often result in a more comfortable posture. And then lastly, I recommend investing in a donut pillow. These are really helpful for when you are needing to sit for prolonged periods of time and especially for travel. Basically what it does is it creates this circular pillow that you sit directly on, and it offloads the tailbone from being able to make direct contact with the seat. And this often makes it a lot more comfortable to be in this position for prolonged periods of time as you are overcoming tailbone pain. So now let's talk about the long-term strategies to get rid of your tailbone pain for good. So earlier I mentioned there are a lot of muscles that attach to your tailbone. So remember, we have your spinal muscles, your hip muscles, and your pelvic floor muscles. So in order to overcome tailbone pain, we need to address any tension and tightness in these areas and strengthen those muscles as a result so that they are not creating a tug-of-war on your tailbone. So how do I do this with my patients? So first, I teach them about breathing mechanics. Your diaphragm and your pelvic floor work together. If we're not breathing well, then our pelvic floor also cannot lengthen and contract well. So we need to start with breathing mechanics as step one. Number two, then I work on hip strengthening and core strengthening with our breathing. That ties the pelvic floor, your hip muscles, and your core muscles together, which helps our body to be able to move well. And this then reduces extra stress and strain on your tailbone, getting rid of that pain for good. So if you want some videos that teach you about breathing and hip and core strengthening, be sure to check out those videos down in the description below. And finally, if you are someone who suffers with irritable bowel syndrome or constipation on a regular basis, both of these conditions create an increase in pelvic floor tension over time. And that tightness throughout the back portion of the pelvic floor attaches directly to the tailbone. And so being really thoughtful to address what is the underlying cause of your constipation or irritable bowels is really important. So if you haven't already, I highly recommend consulting with a gastroenterologist to be able to figure out what is causing your underlying symptoms. And from a muscular standpoint, something that can help to improve that pelvic floor tightness is working on pelvic floor relaxation to be able to generate more length through those pelvic floor muscles while you are addressing the root cause of your IBS or constipation symptoms. And I'll be sure to link those videos in the description below. I hope you learned some actionable tips to overcome your tailbone pain for good in today's video. Feel free to drop whatever questions you have about tailbone pain in the comments below, and I look forward to catching you in the next video.